Raymond Salas is on the mend.
Dr. Shay explained what happened to me and said from that I was doing up to now, I'm doing okay.
Mr. Salas is awake and talking again after a life-saving procedure performed last Friday by GRMC Neurointerventional Radiologist Dr. Shay.
So this 59-year-old gentleman sustained a thunderclap headache and had neurologic impairment leading to actually a comatose state on the 18th of July. He was at home at the time. It was in late evening. The family called 911.
The thing that I remember is my head was in pain, deep pain.
Mr. Salas was taken initially to the closest medical facility, Naval Hospital, where he remained until his condition improved enough to transfer him here to GRMC.
So I don't know what happened until the following 2-3 days that they told me that I got a stroke, massive stroke. And the thing on my brain burst, one of the veins. So right now, the doctor went in and did something. That's why I'm here right now.
What Dr. Shay did was perform a coil embolization, a minimally invasive procedure.
So the conventional treatment would be to open the skull and put a clip, a titanium clip across the neck of the aneurysm to pinch off the neck to prevent blood from flowing into the aneurysm so it can't bleed. Approximately 20 years ago, man came up with a less invasive way of treating brain aneurysms, whereby we crawl through the blood vessels like I just mentioned and actually get a microcatheter or a long hollow straw, if you will, from the leg up into the aneurysm and then fill up the aneurysm sac, if you will, with very soft platinum strands of metal that configure into a coil loop, various sizes and shapes. So we call it coil embolization.
I feel great now, 100%. I could get up and walk. I could still remember things. I could still remember my kids. So.
His recovery was very quick. Within 24 hours, he was transferred out of the ICU to the floor, where he is currently continuing to improve. Because he was in a coma, because he was basically bedridden and for as long as he was prior to arriving here, he's got generalized muscle weakness, so he's going through aggressive physical therapy. We don't want him to sustain a fall, so we're kind of getting him tuned up before he goes home. But he's feeding himself, he's walking, he's bathing, talking. He's basically neurologically intact.
It was extreme with making the decision, but with Dr. Shay being knowledgeable and skilled, he was straightforward, told me the procedures, not once but twice, and then told us all the extra stuff. And from there, the decision was signing the paper and having my dad fall into his hands. We're very blessed.
And I thank God that I'm here. They did it, and so happy he's here for me and my kids and the families.
We've had some issues with staffing because of nursing, visa issues, but we have not shut down the lab with regards to stroke. Ischemic stroke or hemorrhagic stroke. I've been kind of creative, but we've had people from the OR staff, people from radiology, so we are still up and operational and have been since I started the program.
All I could say is I owe him my life, and I thank him from my bottom of my heart that he was there during that time happened to me.
To learn more about the stroke treatments available at GRMC, call us at 645-5500 and ask for the Neuroscience Department.